It can be so tough when your little one is feeling under the weather, especially when they cannot quite tell you what is wrong. You just want to ease their discomfort and figure out what is happening. Knowing if your child has a sore throat often comes down to observing a combination of their behavior, how they speak, and specific physical signs. Unlike adults who can clearly describe their symptoms, children often communicate their pain through actions and general fussiness. The primary reason children struggle to articulate throat pain is simply their age and developing language skills. Toddlers and very young children might not have the vocabulary to say "my throat hurts." Instead, their discomfort presents itself as a refusal to eat or drink, especially solid foods or acidic juices. You might also notice difficulty swallowing, where they wince or make a face while trying to get food down. Another key sign is a change in their voice, perhaps sounding hoarse or muffled, and sometimes you can physically see redness or swelling in the back of their throat if they let you look. Remember, a sore throat is often a symptom of another underlying condition, such as a common cold, the flu, or even strep throat. To accurately check for a sore throat, encourage your child to open their mouth wide in a well-lit area. You can use a small flashlight for a better view. Look for any redness, swelling, white spots, or pus on the tonsils or the back of the throat. Observe their behavior closely. Are they drooling more than usual, which can indicate painful swallowing? Are they refusing their favorite snacks or drinks? Do they have a fever, headache, or swollen glands in their neck? Combining these observations will give you a clearer picture. It is also helpful to understand that many sore throats are caused by viral infections, which often come with other cold-like symptoms such as a runny nose, cough, and sneezing. Bacterial infections like strep throat, however, might present with a sudden onset of throat pain, fever, and sometimes a rash, but usually without a cough or runny nose. Knowing these distinctions can help you communicate effectively with your doctor. Ultimately, recognizing a sore throat in your child involves being an attentive observer of both their physical symptoms and their behavioral cues. By paying close attention to these signs, you can provide comfort, decide when professional medical advice is needed, and help your child feel better sooner.